Great. Well, welcome everybody to tonight's event. We're here tonight to discuss whether COVID-19 is a disaster for gender equality or a leapfrog opportunity. We're joined tonight by my friend Lisa Witter. She's the co-founder of Apolitical and their executive chairman. She is also a gender policy expert and an author of The She Spot, Why Women Are the Market for Changing the World and How to Reach Them. She's based in Berlin, and I think she's coming to us from her country, little pad. Welcome, Lisa, and thank you for joining us today.
Thanks, Joe, and thanks everyone for joining. I am very lucky. I'm in former East Germany in an old barn with lots of birds chirping, kids running around, and dogs barking. So apologies in advance for the very human nature of this. And thanks everyone for joining. I know everyone's been on so many Zoom calls, so feel free to stretch and stand up and don't feel like you have to stare at me or this. So I wanted to start off by, if everyone could just put in the chat box, like in a word or two, why you joined tonight. Is it that you're frustrated around the gender response? Is it that you feel opportunities? Is that you're curious? Is that you're, whatever it is, like why did you join? I'd love to just see that flow very quickly. Or if there was a particular question you wanted to make sure you got answered. I'll give you a second in the chat box. It could be in a word.
Okay, so I joined because I'm also active on the board of Level 20, which tries to get gender equality in private equity. And I saw also in the last financial crisis that a lot of women were sort of like first fired and last rehired when the market came back up. And we also try to always find opportunities to convince more companies to hire more women and get more diversity.
Great, thanks. Thank you. Disproportionate impact on women, what we can do, from Florence. Joined because I'm curious. 21-year-old daughter is 2, studying gender. Fantastic. Great, so you could keep that going in. So what I'm gonna do is I'm gonna give you, I'm gonna go pretty quickly through just some background information and then some observations, and then kick it open for conversation with some polling in between. So I'm going to share my screen with you. Great, and I'm just going to view. Super. Okay. There we go. I'm just going to leave it like this because it's easier. Maybe if I could hold on. Sorry. Okay, so COVID-19 disaster or leapfrog. Well, I wanted to start off with a picture speaks 1,000 words. As many of you have seen, there have been a lot of gendered leadership responses, I would say, in this. We have the Prime Minister of Finland, New Zealand, Iceland, and Germany, all places where, for various reasons, the response has been quite swift and quote unquote effective on many, many levels. I would posit that it's not an accident for this. These women in particular have a different approach to how they do things. Even Merkel, who doesn't call herself a feminist, surrounds herself with gendered sort of thinking. And as you could see from some of her press conferences, if you have, has taken this leadership role very, very seriously. So I'm going to come back to leadership in a moment. And if I could sort of give a big frame to this, this is like, we need more pills and less words. Pills being practical innovation, leadership, and leapfrog solutions at this time. And I focus on solutions here because a lot of the narrative in the media now has been how bad it is for women and a lot of the problem, but not enough about what we can do about it. So I want to focus a little bit more on that. So pills. I will give you a quiz at the end, so pay attention closely. So I'm going to quickly give some new survey we just have just fresh off the press on what public servants are thinking about COVID-19. I'm going to give you a little gender 2020 context, where we were before all of this happened, some pandemic context, then what's the impact, just briefly running through. You read the news, so you know part of it. And then what are the questions for governments? Ellen, the approach I'm taking is very much from a government intervention approach or opportunity approach in that. Not entirely, but a lot. Some recommendations, and then just what to do, what we can do. That's the point I'm most excited about. So Joe, could you pop up? There's 3 quick polls I want to do with this group. So if you could pop that up, that would be great. So for every 3 men quoted on COVID-19 topics in the news, how many women are quoted? 3 to 3, equal, 2 to 3, 1 to 3, or none? Okay, let's go ahead and call it, Joe. Okay, I'm going to come back to that. So this group thinks it's 1 to 3. Okay, let's go to the next one. What percentage of frontline health and social workers are women? 90, 70, 50, or 30? Okay, let's call it at 30 seconds. So you did 70%. So we'll check your answers in a few minutes here. And then the last one. When asking public servants, this has to do with our poll, what economic and social challenges are you confronting in your jobs? Which were the top? Supporting the needs of vulnerable populations, supporting small business, supporting larger firms, and designing appropriate fiscal stimulus measures. What do you think people in government said? Okay, Joe, let's call it at the minute mark. Okay, so most people think it's fiscal stimulus. Okay, so now I'm going to go back to the presentation. We're going to look at how this gender intelligence, the group, how you guys are doing on gender intelligence. So just to give you a bit of context, Apolitical is a peer-to-peer learning platform for people in governments. We have more than 65,000 members, so we spend a lot of time with people in government. We are booming right now because folks from all over the world, it's basically a giant, people are exchanging what to do, what happened in Italy, how can we learn from that? What's going on in South Korea? How do we bring that? How do we bring this to Africa? How are the situations different? So we are on a big uptick right now, helping people in government learn from one another and doing a lot of response around that. And like I said, we're in 170 countries, so we have a big bird's eye view on what's different and alike. And what's interesting, this is a giant experiment in the whole world, or nearly the whole world, being impacted. So there'll be a lot of cross-policy combinations for you policy geeks out there to be able to look, compare, and contrast. And we have a deep gender expertise baked into what we do. It's something I care a lot about, and I frankly think you don't do good policy if you don't have a gender lens. So around the world, we have folks in senior level positions looking at gender policy, from ministers to mayors to digital experts. So we have a lot of that. And every year we do a gender equality top 100, where we recognize women and a few good men who are really leading the field. We're the first of our type in the world to do this, and it's given great power to the people inside of their governments to actually push forward for more reform. So very happy to share that. My colleague Hector is going to be popping into the chat links to these things if it's something you want to learn more about. So on the last question that I gave you, survey of public servants' needs during COVID-19, mostly global response, you can see here. Very interestingly, it was the opposite. The number one was supporting the needs of vulnerable populations, and then supporting small businesses. Both of them, if you do not have a gender lens, you will not have good policy. So our public servants are thinking about this and trying to bring, we know, a gender lens to what they do, although they need support doing that, and I'll explain more. I just thought I'd share this too. What medical challenges are you facing for your government, not yourself? Sourcing masks. We've been asked to help governments talk with one another to source masks, even more than ventilators. And we'll see this as this goes. So for those of you who are thinking about economic stimulus, yes, it's going to be really important to have a gender lens to that. But right now we're at the crisis. It's the vulnerable populations, and we're going to see here in a minute how that impacts women. So let me step back before COVID, where we were. So 2020, we are still 100 years from having gender equality based on WEF's Global Gender Gap Report, so 100 years away. Where the huge gap is, we made a lot of gains in education and health. There's still much more to do, but you'll see the biggest gap is in political participation, which then trickles down into policies in all types of parts of our society. So you can see only 25% of people are women in Congresses and 21% in global ministries, and only 47% have had heads of state. So in the last 50 years. So there's a huge political gap, which goes to the L in my pills, which is the leadership piece. Many of us were gearing up. Go ahead and put in the chat box if you were part of this in some way on generation equality. It's 25 years of championing women's rights. This is when Hillary Clinton said women's rights are human rights. Lots of money and focus and commitments from Mexico and France and countries all over the world to really accelerate towards the global goals. And COVID hits, and all of this has been put on hold, at least the physical gathering. Everything's been postponed for a year. So what does this mean for all of that energy and activity and grassroots activity? To give you a little bit of context, in pandemics, what normally happens? Well, an epidemic outbreaks, there's education gaps. There's often an erosion of rights. We see this through Ebola, and lots of people are looking back at the Ebola crisis and other crises to take a look at this. Food security becomes an issue. Where do you get food? Health and well-being, power grabbing, and livelihoods are all things that are impacted. And this is not gender neutral, right? And we also need to think about the intersections in this. And pandemics magnify everything that's wrong in a society already, the inequalities and gender norms and roles. Policies right now for women are not being decided by women because of that leadership gap that we're seeing for the most part. There are exceptions, like I said. In the past, up to now, women and gender have marginally been incorporated into health surveillance, so data, so detection and prevention. So all of the work that hasn't been done only gets magnified during this. And fascinatingly, evidence-based on the gendered impacts of outbreak is really, really limited. From Zika and Ebola, out of the 29 million papers that were written, less than 1% explored gender in some way. So we didn't learn from the past much on gender, which I also think is an opportunity going ahead. So what's the impact? So these are all slides from UN Women that you may have seen in social media. But back to your question number 2, I asked you, you were right that 70% of health and social care workers are women. And as a way to celebrate and honor that, one of the things they did in China as the outbreak hit there first is they started putting up posters sort of honoring these women in the front lines. Is that an opportunity for us to do? How do we really make the role of women now much more visible so that we do see that? China has done it, perhaps our governments can as well. Interestingly enough, in Spain, infection cases are twice as high for female health workers. Why is that? We don't know yet, but not only are there more of them, but they're being impacted more. And pay inequity only gets wider during these moments. So they're upfront, there are more of them in the Spain case are being impacted, yet the pay is less. So we see this widening. 84% of single parent households are women living alone with children. So imagine the burden of care as they're trying to do other things. 74 million women work in the informal employment world, which gets no unemployment benefits if they live in a country which even offers them that. Women do 3 times as much of the unpaid care. And every day, 137 women across the world are killed by their own family member. So there's been a lot of talk about the impact of intimate partner violence, which we know during Ebola and other outbreaks. And back to the first quiz that we had, for every 3 men quoted in the media, 1 of them is women. So we don't even have gender equity when it comes to talking about this on the news. And those of you who study gender norms, if you can't see it, you can't be it. So there's a lot of work to do to get more female and diverse populations up there. So you guys were right on that one. Right on 2 and wrong on 1. Pretty good. So what questions should governments be asking right now? So I think one of the most important questions is, have you considered the voices of women actually in the process? Very important. Listen to them. Lots of research shows you get better policy if you actually listen to the users. How are you targeting your economic response to that, which is listening? So the small business, vulnerable populations, how are you thinking about how that might apply differently around gender? If you're thinking about cash transfers, which we're seeing all over the world, the US has just done it. It's done in different ways in other countries. How do you get it to individuals versus heads of household, which only create more problems, sometimes violence, sometimes the money doesn't get to the women. So how can you do that? I was just on the line with someone who works in the ministry in Tonga, and they are in Togo, and they are doing every person. So women actually get more than men. You can see this here, and it goes directly to their phone accounts. So here's where the developing world may have a quicker response than some of our more developed nations, quote unquote, and getting cash to them. So there's some good innovation, and technology can help really bridge the gap for women in these countries. Are you targeting intervention for single parents, just like this happened? Does your administration know the situation of elderly? So there are more older women than there are older men. Women outlive men. So COVID, it's interesting that right now more men have died, although we don't know the full data, but do we know what's going on with these elderly women around food and medication? Women's health, particularly the health of mothers. Obviously, this is a concern that women have that men don't in pregnancy and childbirth. Are you supporting caregivers? So, and Guatemala is doing a lot of work in providing online learning for kids. And this is a big deal for Guatemala. This makes the moms or fathers work much easier because their children are occupied online while they're cooking or getting food. Some of the same things are happening in the US. So how can you design around that? Now, talking about food, women around the world are overrepresented in these low-paid food work, grocery stores and agriculture. So if they're doing literally the brunt of the labor to bring food to our tables, how are we thinking about their situation and safety? And then how do you make sure in some cultures where girls aren't given equal opportunity that they're not finding themselves pulled out of learning situations and now taking care of grandparents? Now, that might need to happen. All of us may need to do that, but is it gendered? And then again, on health insurance, because there are less women in the formal labor force, less women have health insurance. So how are we thinking about that? And then lastly, what is the response plan to increase the prevention of violence against women? Now, some really good practical stuff is going on around this. Greenland has been shutting down alcohol sales. So with more alcohol comes more violence, particularly if you shut in with an abuser. Lots of work on keeping hotlines more open, keeping shelters open and not converting them into hospitals, so there's a safe place for non-sick people to go. As there's been a move to release prisoners, don't release abusers because they go back home to the place that brought them there in the first time. That's really, really important. And letting the officials and public know that this is happening and outreaching to folks. So in France is doing really fascinating work. They have an amazing minister of gender who is like really on this and has been before even the COVID crisis around violence. There's been big movements coming off the back of Me Too. They're providing kind of secret code words for women to go to pharmacies to ask for a certain type of mask, which means then they get help from a domestic violence perspective. So there are ideas out there. And I would say in this place, they're more concrete than we're seeing anywhere. So it's not just important to think about how it's disproportionately impacting women and why that's wrong and how we need to do something about it. But also when we get to a vaccine, We need women, because we know through polio and other types of mass vaccination that if you don't have empowered women and the support all around her, vaccines don't go to the right people. I know for a fact that Melinda Gates is really worried about this. And this is how Gates got onto the journey of gender equality. Is all, you can have all the vaccines in the world, but it's the women who create the social norms, who do the delivery, who create the trust. So this is not just secondary response. This is like the women who will have the needles in their hands. And a lot of the world, if they're not supported and brought in, the COVID will last longer and have more impact. So this is primary response. So it's in all of our best interests that we're thinking about gender and all of this. So what are the recommendations? So this is when I start getting a little bit dark. So basically, the UN has come out with some 8 really clear steps, which is great. Data, internal gender response teams, support women on the front line, decision-making, health messages, right to women, economic resilience, essential health services, and gender-based violence. This is all great, and I've given you some specific things that are going on, and there are more, obviously, but it's mostly words. And I don't mean that they're empty words, as in it's not meant from the right place. But what we're finding in general, as we find at Apolitical, and not just in this COVID response, there's lots of you should, but not this is how to do it, and we'll support you in doing it. And we're seeing that through this as well. It's like, here are guidelines. Guidelines are great, but they're not practical ways to actually get it done. So what to do? I'm almost done, and then we'll open up for conversations, both during and beyond. So in the short term, there has to be much more specific, practical, easily laid out, this is what you can do. So how do we replicate what's going on in France here? Or how do the Togolese share their data? That stuff needs to go viral, and that's what we're trying to do at Apolitical, but it needs to go way beyond us. We don't just need advocates saying, this is so bad, this is so bad, it's so bad for women. Yeah, that's great, but then what do you do about it, and what's practical? So from outrage to action, we really need to move. And then support on implementation. We need to seize and spotlight current women's leadership. So this is about social norm changing. So that's why I started this presentation with these 4 political leaders. There's a lot of bad news going on in the world, but let's spotlight the women that are doing great stuff. Why women and not men? Great men are great too. But if only 1 to 3 women are being seen as experts on COVID, there are less women in our lives right now. So all this progress we have made, if we don't continue to lift women's voices, we don't want to slip back. Ensure that gender lens is at the table, particularly in these economic stimulus packages. How is someone thinking about gender lens? Because once it gets baked in, then you can have generational effects. And how do you look for leapfrog opportunities? So instead of saying we want gender at the table, how do we sort of say, oh, we need a whole new system? And some places that might be universal health. That is a huge leapfrog. That's not just equaling things out now, that's like changing gender forever. And not being afraid, if you're a women's advocate, to look for backdoor policies. So it doesn't have to look like a gendered policy to be a gendered policy. So for example, one of the things we found in India to reduce violence against women and girls is to change the way inheritance works. So that it can go to men and women equally. And that way we've seen a reduction of violence. They aren't beating up or killing women as much. So are there ways to look at backdoor things like inheritance and tax policy, which is often where a lot of money is, to advance gender? And we have to be collecting data, otherwise we won't know, and intersectional data, not just gender, but gender and other class and race. And if you're a philanthropist on the line here, how do you do more surge funding to actually support this sort of activity right now? So a lot of philanthropy is pulling back. I understand people got hit in the markets, but now's the time to surge, to look for and advance those leapfrog opportunities, and to get very, very practical. So that's an easy thing to say. And not just for philanthropy, it could be for companies that are providing new ways too. So this is an opportunity, Susan Beagle's on the line, but to double down on gender lens investing, to double down on supporting gender in every way, because we can bring those solutions to the table. In the longer term, what needs to happen, again, the need for practical solutions, and not just these are the problems, everything's so bad, but to focus on, okay, what do we do about it? We have ideas. Elect women. and gender-aware men. It would change everything if we had more women elected. Imagine if it were 50-50 in all those houses. To continue to have this leapfrog thinking, we don't just want to equalize, we want to have new and different, creating new tables perhaps. Really focus on solutions that change balance and gender norms. So instead of just saying, hey, here's equal money, does that actually change the power dynamics between men and women in the long run? A lot of research says that it doesn't. So how do you have actually gender transformative policies? We know a lot about how to do that. So that needs to be built in. It can happen in the shorter term too. And we've got to study this. It's unacceptable that less than 1% of the 29 million reports done on Zika and Ebola, less than 1% were about gender. So that lack of knowledge is hurting us right now. And the last thing I'll lead is my dream is to create a covert operation to support women in power. So I've been trying to get someone to fund like a secret or not so secret identification of what are the 400 most powerful positions in the world, and how do we have a secret pipeline that when we hear about that, there's an early response system so we can get women in power. This is not to get rid of men, we like men, but to have more gender equality. Like you were saying, Ellen, like when these board seats come up, if the guys are in the loop and there's no sort of surround sound for women, the guys are gonna get it. They're not being sexist necessarily, they're just pool isn't there. So they need a prod. So how do we actually do more to create those pipelines? And there's lots of people interested in doing this. So that could be quite fun. So again, we need more pills and less words. Like the anecdote to this is more practical, not just complaining, more innovation. I'm an entrepreneur. Innovation happens in the time of crisis. I'm in love with this crisis, not for all the bad things, but for the innovation it's requiring. This is our opportunity, and to have leapfrog innovation, more leadership and spotlighting it, and really focused on solutions and not just problems. So, Joe, can you put up the 3 polling questions, and then we'll have a conversation. So number 1, what are pills? Birth control, pharmacy intervention for limited literacy, premium internet lead line, or acronym as a remedy? It's just really to see if you were listening. Thanks for the smile, Suzanne Beagle in the hat. We need more pills. Probably gonna need more birth control pills these days too. Seems like there's gonna be a baby boom. Okay, I think this group's got it. Let's go to the next one. There we go, close poll. Where do you think the biggest leapfrog opportunities are in gender and COVID? Electing more women off the back of it, universal health care, equal pay, or really showing women's value in the supply chain that's not taken for granted. Periods do not stop in pandemics, that is for sure. I wonder if there's been a run on tampons the same way as toilet paper. I probably think not, but I'd be interested. Has there been, Suzanne? I can imagine. So this group, 50% or more thinking about women's value in the supply chain. That probably aligns with the 70%. Great, and let's go to the last question.
You only had 5 questions.
Oh, I only had 5. That was the last question. Okay, fantastic. I thought I had 6 for some reason. So I want to open it up to questions, feedback, other ideas that people have, good news that people want to share, and yeah, and starts by coming off mute or typing it in the chat Zoom. Nothing? Okay, then I'll ask another question. So could you all type in your 1-word takeaway from this? What really stuck with you? It could be a sentence too. What really stuck about this? Or did anyone disagree with me? I like that. Hope, share learnings.
Can I just say that I mean, that was very breathless. I really hope that I can see the slides again after.
Yes, I will share it.
I really appreciate what you're doing and the knowledge that you've gathered. But I made a comment in the chat box there that it's almost all women who are on this this event, this meeting, and my challenge I found over the last 3 years of doing work around this is getting men involved. You're not going to get men involved and voted into places, sorry, women voted into positions of influence unless you can engage men. So it seems to me the greatest challenge in all this is how to get men seeing the value of making space for women. Because that's to me, is the greatest passport to making change.
Tom, as one of a few guys, Mark is on here too, and others, do you have any thoughts or advice on it? I mean, one thing I find just interesting is everybody wants a vaccine, and women are going to be important around it. So like the utility arguments around gender is one of them. But I'm just curious from your perspective, what's worked? Like what drew you in to coming, and why do you care?
Well, I suppose because I've been involved in trauma work and the damage that's done to people when they're abused, and you know, I've had personal experience of that, and that's what's really sort of drives me in all this. But I think that one of the dangers is having very powerful women's voices that make men wrong, and it's so easy to do that, but you will push away men more than you will attract them by doing that. So it's almost a paradox. I mean, in a sense, it's almost how do you use your feminine wiles to draw men in to see the value of women being fully expressed? This needs a lot of thought, it needs a lot of subtlety, but just hitting people with hard numbers and that, I mean, it's shocking, and it'll get through to some people, but there's so much vested interest in most men staying where they are and holding on to the power that they have. It's got to be, it's almost like they've got to be seduced away from it. Yeah.
A seduction of power.
Why not?
It sounds very Shakespearean. Mark, yeah, welcome.
I have a very simple solution. You have 3 daughters and bring them up in New York, and you have no choice but to be part of trying to find a solution here. No, that's very flippant, but I don't know. I think just constant learning men and women, and I think we as a male species needed a lot more, obviously.
You see, if you look at the way that people celebrate Jacinda Ardern, because she is so amazing and she has been setting such a fantastic example, but there's an awful lot of men who just push that away because it makes them feel small. I mean, you're dealing with male egos here.
Such a big question. I want to open it up to other folks for, you know, there's he for she. There's a lot of stuff that's going on. I just want to say I'm the mother of 2 boys on the opposite spectrum, and I think every day about how, and I work on women's issues and I work on lots of different things, and I test them all the time about whether it feels inclusive or not to them, and they are feeling mostly that it is, but sometimes that it's not. And so it's a real challenge, but I also think a real opportunity. Other people have thoughts about, let me see, Suzanne says, when you introduce more women in the boardrooms, board meetings start on time, go better, more diverse decision-making drives better decisions. We have more, Jack Dorsey made a big announcement on girls' education and healthcare. He just, I think, is given $1 billion, giving $1 billion. That's not. Ellen would love to learn more about the practical opportunities you have and examples of female leadership from COVID, so we can push that. One thing that everyone could do today is to look for a female leader you're seeing doing a great job around COVID and tweet it out, whether that's Jacinda or it's super, you know, the Prime Minister of Iceland or the person who runs your borough, or, you know, the Minister of Health or whatever it is, just say, hey, this is inspired leadership, and show her face. It's super important that we have these out, really, really practical. We're going to be doing we do sort of awards. We were going to do a Global Public Servant of the Year award, but it's not the right year to do this. So we're going to be asking, crowdsourcing from public servants around the world who within their governments have shown extraordinary leadership on COVID. And when that happens, if people are interested, we can share, because I know a lot of women are going to be at the front lines of some of that amazing work that's being done. Looking for other questions or comments or ideas. Ellen Johnson-Sirleaf had a webinar last night on lessons from Ebola. Fantastic. Yeah, lots to learn from her. Can you imagine? Can you imagine if Ebola was airborne? I can't imagine what the world would be. And other thoughts, ideas, frustrations? No? With that, then, Joe, I'll turn it back over to you. I know you guys like to keep these short and sweet, but I'm so grateful for you all being here, the men, women, and the in-betweens. I, as you can tell, am so focused on solutions. We created a whole company that's a peer-to-peer learning platform for people in government, not just to focus on the problems, but practically what you can do, because that's what we need now. We always need it, but we particularly need it now. So we're in service, and if there's ways we can be collaborating, it's a super exciting time for us to be doing this. I wish everyone best. I will make sure a copy of this gets shared via Joe. Joe, is that okay to do?
Yeah, we'll get this and we'll collate all of the links that Hex was also sending around. So if there's anything anyone else wants to share as well, I know, Suzanne, you've put in a few links in the chat. If anyone else has anything else they think is particularly great to share, ping them over now in the chat and I'll collate everything and send it out as a resource.
Yeah,
Joe, can I ask? Sorry, go ahead, Suzanne. Yeah.
Yeah, I just want to add that the conversation we've been having in the Gender Lens investing community is, as capital is slowing in the private sector, the one place that capital is continuing to flow is from the public sector. And so whether that's development finance institutions, multilaterals, from the aid agencies, and they're looking for public-private partnerships. And as these big pools of capital are being decided, the IFCs and the EBRDs and et cetera, making sure that gender is on the agenda and that these new vehicles, these COVID response vehicles, are designed with a gender lens in mind is really, really critical. And that means a lot of other voices that are influencing them and co-investing with them need to be putting that agenda forward. And so that's the thing that I'm thinking about and working on right now quite a lot. And then also amplifying where are the response vehicles which are not taking into account gender, what they could do about it, practically, tactically, how they could add a gender lens into what they're doing. And just the importance, I just want to reinforce about the data, that using gender data to make better decisions, being relevant now and being relevant both in a relief context but also in a recovery context.
Thank you. Thank you. Anyone else? Final comments? Because I have one more thing I'd like everyone to do, if not. So what are the, someone? Yeah, I heard someone.
Oh, yeah, no, I just wanted to see and also maybe work with Suzanne on thinking about this, like how we also can take all the work you've done more on the political government side into business and indeed investments and also investment funds. Yeah. So I'd like to be in touch with you, Suzanne.
And yeah, let's ping each other our contact info. And I'm a Conduit member, so.
Oh, great, yeah.
Fantastic. I have to say, it's been really interesting as someone who has worked in government and been in and around it, how government has fallen out of such deep fashion for such a long time. And yet in a crisis, you see both the need for great politicians and how important it is to be civically active, but also how important government is. There's a quote going around that we've privatized wealth and made public all the risk. But now's a time where you're going to see institutions through procurement. That's a $10 trillion market. We're watching it in the US right now, particularly with money going to GM to create ventilators and so forth. And if we don't have women at the table, it's not going to happen with the gender lens. And, good leadership knows that you need to step up in a crisis, but it's what you do before the crisis that means you respond well during the crisis. And so we need to learn from this, do the best we can, but be better prepared for the next one, because with climate coming, there will be more. And so this is our opportunity to learn and grow. So I want to ask everyone, my background is in behavioral science. And one of the things we know in behavioral science is that if you make a public commitment, you are more likely to do it, because you don't want to seem like the jerk who said yes and then said no. So could I have everyone raise their right hands? And if you're on camera, if you're off camera, can you come off of it? It's a very simple request. Will everyone make a commitment in the next 24 hours to tweet or share on social a solution around gender and COVID and or excellent women's leadership? Something you see, Jacinda or someone who you see that. These are simple things that make a big difference. And with that, Joe, I'll turn it over to you. Thank you everyone for caring.
Thank you so much, Lisa. Thank you everyone for joining us. It's a nice segue because I actually have to end this call and jump straight onto a conversation on climate action in time of COVID with Nigel Topping. So if you guys want to join us for that, I'm literally deactivating this one and activating the other one.
Joe, ask about the gender lens though.
Well,
make sure it gets asked.
Funny you should say that. So me and Suzanne are planning an event on gender lens investing and the intersection of climate. So that is coming very, very soon when I get back to Suzanne with a date. So please all join us for that. And maybe an extra challenge for everyone is everyone joining this call, you need to join that event, but you need to bring a guest male with you, and all of the men join. You can obviously bring a guest woman, but at least then we'll have a lot more men on the call, and hopefully they will be better informed about some of these conversations as well. So that's the challenge for when that comes up, and I'll make sure you all get a ping to know that it's happening. But thank you so much, Lisa, for your time, and Hector for joining us, and we will see you all very soon. Take care and have a good Easter.